Hi everyone, thank you for coming to your surgery group discharge promptly today. We do appreciate that. In just a minute, we're going to be handing everybody their surgery paperwork for today. The first document in this paperwork is all of the medical records from your pet's visit today. Starting with what the doctor saw on the pre-surgical exam. Any concerns will be noted there. Also, any procedures performed today will also be documented, including vaccines, flea treatment, microchip, anything like that. Please pay special attention to the vaccines. If your pet needs to come in for a booster, either in the next 3 to 4 weeks or in a year, that will be documented there, so you'll want to make note of that. Also included in the medical record are all of the post-op instructions. We're going to go through all of these with you in just a few minutes, but they are there for you to take home to and refer to later. The next document in your package will be your certificate of rabies vaccination, if your pet got one today, and a new tag. Also, a certificate of spay or neuter is also included. Keep in mind that these two documents, the rabies certificate and the spay or neuter certificate, are the two documents that you need to get your dog licensed through your town or city. If your pet was microchipped today, there'll also be a certificate of microchip registration. We do encourage you to remember that if you should move, even 5-10 years from now, you have to update your information with the microchip company, or they won't be able to track you should your dog get lost or stolen. Also included in your surgery paperwork will be a little baggie with a vial of take-home pain medication. In just a few minutes, we'll go through all of that with you as well. And lastly, you'll be going home today with one of the e-collars or cones. In just a few minutes, we'll also talk about how long your dog should wear this, how to put it on, all of that. In a nutshell, we do recommend that you keep your dogs as quiet as possible for the next 10 to 14 days. What we mean by this is, please don't go out on any long hikes, allow the dog to run the law line, or take the dog out and throw the ball for them. We want, especially in the next 2 to 3 days, for them to remain somewhat quiet to allow them to start to heal. We want you to watch their incision area carefully also for the next 2 weeks or so. Check it twice daily for any signs of infection, such as any kind of a discharge, pronounced bleeding, swelling, opening up of the incision site once it's all closed up. Anything like that would definitely warrant a call to RCAC or any other full-service animal hospital. So also you'll want to keep their incision areas clean and dry for the next 14 days. So please no bathing, swimming, grooming, anything like that. If your dog should go outside and lay in a muddy puddle, just damp cloth, clean them off gently. Please don't apply any ointments, creams, or other antibacterial solutions to their incision. Also, we don't want you to cover the incision because the air is going to enable that area to heal up nicely. So the female dog's incision area is going to be right front and center around the belly button area. You'll also notice a very small green tattoo, which is just a universal sign that she has already been spayed. All of the dogs here receive what's called a scrotal neuter. And unless otherwise noted, your dog will have received a small incision right on the scrotal area. That incision will likely look slightly open for the next 24 to 48 hours. That's completely normal. So please don't go home and think, oh my goodness, the dog already popped a stitch and opened himself up. He certainly is stitched up internally, but that external area is left open to allow it to drain slightly if necessary. So you may see in the next day or so a drop or two of a real light watery blood. Again, that's very normal. Any pronounced bleeding, however, is not. Okay? Your male dogs will also have a very small green tattoo in that area, indicating that they have been neutered. When you get the dog home today, certainly go ahead and offer fresh water right away and offer a very small amount of food. Even though I'm sure the dogs are going to tell you they're very hungry since you all picked up food last night around midnight, we do recommend you just give them a very small amount of food initially. The anesthesia that they receive in-house can very often make them nauseous, so we want to make sure that they don't scarf down a whole bowl of food and then vomit it up. If they do vomit, please go ahead, withhold food for an hour or two, and start again with a very small amount. Our ideal is to have a little bit of food in their belly by this evening around 9 o'clock. That's when all of you will begin their take-home pain medications. Again, please read your labels very carefully when you get the pain meds home. Some of you will be giving a full tablet, some a half tablet, some a quarter tablet, depending on your dog's weight. All of you, however, will be starting this around 9 o'clock tonight. That's when their in-house pain meds will be starting to wear off. And all of you should continue to get this twice daily for the next 3 days, always with some food in their bellies. This medication will also make them a little nauseous if they have an empty stomach. So again, real important to try and build up so that they have a little bit in their stomachs by about 9 o'clock tonight. In addition to checking your dog's incision site twice daily for the next 10 to 14 days, we also would like you to be very aware of the dog's behavior. Be watching for any signs that the dog is not feeling well, such as lack of appetite, persistent vomiting or diarrhea, or real depression or lethargy. Again, any of those things, along with the incision site problems that we talked about earlier, could be a sign that the dog is getting into some kind of an infection. You definitely would want to call us immediately and try and get the dog in for surgical recheck. If we're not open, please call any other full-service animal hospital that you can find in the phone book or your own vet if you have one. We've also indicated the name and telephone number for the 24-hour, 7-day-a-week emergency care center located over in Henrietta. Please know, however, that it is a critical care center, and just to walk in the door there is over $100. So we're definitely your best bet in the event that you can reach us, or again, any other full-service animal hospital would be your next best bet. When you take your dog home, again, we're also sending all of the pets home with one of the e-collars or cones. These have already been fitted and assembled for your dog. You do not have to unassemble it. All you have to do is untie the gauze, slip the cone right down over the dog's head, and then tighten the gauze up so that it's tight enough so that you can get 2 fingers in there, but the dog can't get his leg or his lower jaw wrapped around there. You can also pull the gauze out and feed your own collar through these little loops at the top if that's easier for you, and if your collar will fit. In any case, it's very important that the dog wears the e-collar for the next 10 to 14 days whenever they're not being supervised directly, to prevent them from licking at their incision areas. That whole idea that a dog's mouth is cleaner than ours is not true. If the dog licks at their incision area, they're likely going to end up with an infection. And if they do get an infection, again, sometimes they need to be opened up, flushed out, resutured, put on antibiotics, and that will be all at your own expense. So please keep this on them whenever you're not directly supervising them, if you leave the house or especially at night. However, when you're right there watching them, if you'd like to take it off so they can more comfortably eat, go ahead and do that. But do know, even though your dog is going to insist that they can't eat or function with this on, they really can, and they will adjust to it if you leave it on for the next 2 weeks. Thank you again for bringing your pet to RCAC for spay or neuter today. By choosing to spay or neuter your pet, not only have you helped our community to correct the overpopulation problem, but you've also taken an important step toward offering your pet a happier, healthier, longer life. Please take a good look over the discharge paperwork that we're sending you home with. And certainly if you have any questions or concerns, just see one of our client service reps or give us a call and let us know how we can help you.